So you think hiring a private caregiver is going to save you a lot of money? Well, that's what we're going to discuss today. My name is Steve Cohn, and I'm with Medical Consulting and Management. So let's talk about some of the key differences. The main thing, number one, is cost and liability. So many folks will hire a private aide, someone they know, maybe a family member, someone who maybe works in the building sometimes, and they think they're going to be saving a lot of money. Well, in reality, what ends up happening is because of the fact that there is a higher level of liability, if something happens, the cost can go through the roof. I'd like to share a story with you, a real live story about something that happened with one of our clients inside the home. If they had not been on board with our agency, it would have ended up costing them close to $100,000 in medical bills. So here's what happened. This is a client who had severe dementia, but she was functional. She was able to walk around and talk and do pretty much what she needed to do physically, but mentally, she just had severe dementia. So in this particular situation, the caregiver was working in the kitchen. She was doing some dishes, putting dishes into the dishwasher, and then she closed the dishwasher. Unbeknownst to her, the client came behind her, opened the dishwasher door. The caregiver turned around and didn't realize it and tripped over the dishwasher door, landing with her elbow on the granite countertop, shattering her elbow, requiring her to go out 911. And again, this was close to $100,000 in medical bills, lost wages, physical therapy, an unbelievable amount of money that the client would have had to have paid if they hadn't hired us. The irony here is that this particular client used to have private aides prior to hiring us. So they decided to hire us, but prior to us being hired, they were using private aides that they were hiring directly. So this could have been a very expensive scenario for them. But luckily, because we have workers' compensation insurance on board that we spend thousands of dollars a year for ourselves as a company, we save them the burden of having to pay for those medical bills and lost wages. Another thing to keep in mind, a lot of people think that their homeowners insurance will just take care of everything. That's not actually the case. In this particular situation, the homeowners insurance would not do anything because the first thing they're going to ask is, was this related to work? When they find out it's related to work, the insurance company automatically goes to look for the other insurance company that's on board. In this case, there was no insurance company. And in most cases, this claim would be completely denied. So there is no coverage if you have homeowners insurance only. So that's one thing to think about when it comes to in-home situations. Another thing regarding homeowners insurance, if there's theft or damage or something breaks in the home, these kinds of things related to a caregiver being there, these things are not covered by your homeowner's insurance typically. So in this particular case, and in many cases, you are actually getting much more for the extra dollars you're spending on working with an agency. You're getting that peace of mind. You're getting the coverage that you need. And you don't have to worry about any of these kinds of things that may go wrong and do go wrong often in the home care business. Number two, one of the other things you want to think about is scheduling. Scheduling and backup support are extremely important things to think about. If you hire a private aide and they're the only person that you've hired and they go out sick or their car breaks down, they can't make it in. Think about recent snowstorms we've had in the Northeast and the Mid-Atlantic states. How are you going to get some coverage there? That means you're going to have to go in and take care of mom or dad or your loved one yourself. Whereas if you're working with an agency, to give you a quick example, we did have a snowstorm recently. We spent over $2,500 ourselves out of our own pockets to cover Uber rides for over 55 caregivers to get to work. So that's not something that's going to be easily done by those who are hiring private aides. And in addition to that, we've had probably close to 60 call outs on one weekend. So 60 people called out. Can you imagine your caregiver calls out? Well, we're able to replace them with no problem whatsoever with another caregiver who's waiting in the wings. Plus, we'll use an Uber to get them to work if we have to. In some cases, I've even driven them in my four-wheel drive Suburban to make sure they get to work. So these are some of the things that you have, the insurance that a company gives you when you have somebody who goes out sick or can't make it to work. Number three, background checks and vetting. These are all very important, obviously. So as an agency, The state of Maryland requires that we do state fingerprint background checks. Well, we do that. Plus, in addition, we do a full national background history to make sure that the people that we're hiring are above board. They have no criminal records. And this is obviously very important when they're coming into your home. So this is an extra step that not a lot of folks will add into their repertoire when they're hiring an individual caregiver through word of mouth, for example, or privately through a family. Another thing that we do is we will check driving records of those caregivers who will be driving clients. And we do drive many clients to appointments, to run errands, to take them to see family members, things like this. We want to make sure that their driving record is clean and that they don't have any, history of a lot of accidents or tickets, things like that. So that's one extra step that we take to make sure that our clients are as safe as they possibly can be. Number 4, oversight and management. This is something that folks don't think about necessarily when they hire private aides. I've run into lots of situations where I actually get calls from people who've hired a couple of private aides and they're trying to figure out how to manage them because they know I'm in the home care business and they're a friend of mine maybe or something like that. They want to know how to handle a conflict or a situation that arises, and they're calling me because I obviously have the experience of dealing with hundreds of caregivers over the years. This is something you need to think about. When you hire caregivers yourself, you become their manager. You oversee everything that they're doing, and you're on the hook for things that happen or go wrong or conflicts between caregivers. In a lot of cases, caregivers do not resolve these things themselves. They require a third party. That's what we are expert at doing. We literally have hundreds of caregivers who've worked for us over the years. Currently, we have on roster close to 200 caregivers. So we know how to deal with the various situations that arise. And these are some of the things that people don't think about, and they will bog down your time. They will cause stress. They will cause extra anxiety. This will be unhealthful to your loved one or your mother, your father. This is something that folks just don't think about. And as an agency, we provide that buffer between you and the caregivers that helps smooth things over and rectify these difficult situations that do arise frequently. Number 5, training and quality control. When you hire privately, when you hire a private caregiver yourself, you don't necessarily have any control over their training, where they've been, the kinds of experience that they've had over the years. All you can do is really listen to what they're telling you. Whereas with an agency, you know that the caregivers are all going to be run through RNs, at least through our agency. RNs will oversee the training and making sure that the plan of care that is set up by the nurses is followed for each of our clients. This is very important because you want to make sure that the level of care is consistent and of the highest quality possible. And so that's one of the reasons that the level of training and support that the caregiver gets is something that an agency can absolutely support you with. Whereas if you hire someone independently, it's kind of on you. And those are things that people don't always think about. Another thing that we as an agency implement is we do regular oversight of our care coordination situation. So for example, when we start a case, we check in after the first day. We will make sure that we check in with our clients every 1 week, every 30 days, every 60 days, every 30 days thereafter. This gives us a way to make sure that things are running smoothly. We'll check in more often if we have situations where there may be a conflict. For example, let's say a caregiver is not a good fit for some reason, and it does happen. We will make sure that we've heard from the client. We've talked to the caregiver. We make sure that there is a match going forward when we select a new caregiver. When you hire someone privately, you're kind of stuck unless that person has other people that they know that they can bring in, which they're not likely to do because that's what they want to do. They want to work for you. That's their livelihood. Through an agency, you have many choices. And again, in our case, you'll have up to close to 200 caregivers to back up that person who we can bring in and make sure that we have a proper fit. To learn more about working with us, Medical Consulting and Management, go to our website, www.mcmhomehealth.com. Thank you.